Governor Maura Healey pushing back against the Trump administration and the CDC's latest vaccine changes, including limiting access to the COVID-19 vaccine. Welcome, everyone, to Western Mass News at 10 on this Thursday. I'm Chris Pisano. Western Mass News reporter Reagan Locree now joins us live in studio to explain. Reagan.
Yeah, that's right, Chris. Today, Governor Healey announced a series of immediate measures to ensure that vaccines remain available to Massachusetts residents of all ages. Governor Maura Healey holding a press conference Thursday in Boston just days after U.S. Health Secretary Robert F. Kennedy Jr. praised the Food and Drug Administration's decision to end emergency use authorization for COVID vaccines. Kennedy defending his stance on Capitol Hill today.
We were lied to about everything. We were lied to about natural immunity. We were lied to about, we were told again and again the vaccines would prevent transmission, they'd prevent infection. It wasn't true.
Meanwhile, Governor Healey responded to the federal government's moves. She says the Commonwealth will work to keep vaccines available for all who want them.
Wherever the federal government has created a devastating and harmful gap, we will look to do everything we can to protect the public health of residents in Massachusetts and work with our sister states to stand up and fight for and protect the public health of Americans.
Thursday, the governor announced 3 steps to protect vaccine access in Massachusetts. First step will be to require insurance carriers in Massachusetts to continue to cover vaccines recommended by DPH and not rely solely on federal recommendations. Second, to ensure that Massachusetts residents who want to receive the COVID vaccine can do so at pharmacies. And third, to create a public health collaboration across New England and the Northeast committed to safeguarding public health. Western Mass News spoke with local pediatrician John Healey. He tells us the governor is doing what needs to be done to protect the residents in the Bay State.
People that don't want to be vaccinated aren't going to be vaccinated. No one can force you to take the vaccine, right? But if for those folks that want to be vaccinated, yet struggle to get vaccinated because of barriers put up in their states, and then they travel to other parts of the country, they can be spreading disease.
Dr. Healey tells us he's concerned about backsliding in current efforts to prevent what he calls preventable diseases, and he's worried about what the future may bring.
I'm very concerned that, yes, there are going to be other roadblocks thrown up against vaccines that have been established to be very effective and safe.
Dr. Healey encourages everyone to make sure they are getting all of their health information from a credible source based on science rather than politics. Reporting live in studio, Reagan Locree for Western Mass News.